Well, again, good morning and welcome to our morning briefing. We're glad to have you with us this morning. As you know, the Washington County Chamber of Commerce put this series together to bring you community and business leaders that are making a difference as our community battles the COVID-19 emergency. And this morning, we're very pleased to have an important community leader with us, Jeff Yates, the Director of Public Safety for Washington County. I'd like to thank Jeff for being with us this morning, as well as thanking our sponsors this morning, ATI Flat Rolled Products, California University of Pennsylvania, Dave Davis Communications, Steptoe and Johnson, and Triple. Thank you very much for your continued support. And Jeff, thank you for being with us this morning.
Thank you, Jeff. It's a pleasure being here.
Well, first of all, on behalf of the Chamber and our members, we want to thank you and your team for doing such a wonderful job in keeping us safe during this emergency. So please accept our gratitude and thanks.
Well, thank you again, Jeff. Appreciate it.
Well, we're glad to have you here. And why don't we start by just, if you would mind, bringing us up to date as where Washington County stands during this emergency and what you're seeing out in the community.
Well, right now we've been watching the numbers climb. We're a little bit optimistic right now, given the latest numbers. It looks like things have started to possibly flatten a little bit as far as the numbers increase. But we've been really pleased. We've gotten great support from communities, from emergency responders. Across the board, people have really stepped up and done things that we've asked them to do and done things that we've needed them to do.
Currently, how many cases are there active in Washington County?
Right now, the count from the Department of Health shows us at 70.
Now, last week when we had Brooke Ward from the Washington Health System and Lou Panza from the Monongahela Valley Hospital, they discussed the terms of we are relatively smaller in our caseload here in Washington County. They attributed that to maybe us being more of a rural county and other reasons. Well, why do you think Washington County's growth, I should say, it's been trending good for us not to have as many cases as others, but why do you think that is?
I think there are a few factors that play into that. We are indeed a rural community, and I think that helps a lot, particularly if you look at how our people are as compared to New York City, for example. We have a lot of natural social distancing. I also think we were fortunate in that we got the order for social distancing, universal masking, way ahead of other people. So I think we were a little bit ahead of the curve that way as well. Plus, the stay-at-home order happened, before it happened with other people. So I think when you put those together, I think we're a little better off than the other folks were at this point in the curve.
Now you mentioned the stay-at-home order from the governor, and I know yesterday both the governor and Secretary of Health had some new regulations that came out concerning businesses. Would you mind filling us in on those?
Yes, when the governor and the Secretary of Health talked yesterday, they said that it's important for employers to have their workers wear masks while at work for their own protection, protection of their coworkers. And while that's a good idea, we still come back to the same basic issue of there really aren't enough masks to go around. So as much as that's a good order and it makes sense, mask availability continues to be an issue. Some people are making masks and those work, those are relatively effective, but not everybody knows how to do that or has access to them. So as much as the order may make sense and be a good solution to help people, we still come back to the mask availability being an issue.
Now, that's a good point, because when I read the governor's orders last evening, I went on Amazon and saw that the soonest I could get, a mask would be, late June. What would you recommend employers doing, in the meantime to help protect their employees?
Well, I said having people make their own masks is helpful. Even wearing bandanas across someone's face, even though it might look a little silly, that's still beneficial. It's better than nothing. But as far as ordering masks goes, it's a good idea to take a look, see what you can find. Some people do get lucky and come across small caches here and there, but by and large, they're still very, very difficult to find. We placed some orders in the beginning of March because we kind of anticipated this happening. We had gotten good delivery times and good promises, and pretty much every single order we've placed has either been canceled by the distributor or pushed back and given us delivery dates next month, some as late as December. So I wouldn't really count on being able to purchase them at this point.
Now, I know those masks aren't as effective as, say, N95 masks, but do you find them to be, a pretty good alternative?
Yes, they help. I mean, anything that helps keep the droplets out of someone's respiratory system, is a big help. It's a help as far as the person who's wearing a mask, protecting them from other people, but it also helps protect other people from them.
You mentioned as well, we talked about the hospitals a few seconds ago. How have you been coordinating with our local hospitals on their response to this COVID-19 emergency?
We actually have two groups that we work with the hospitals. We have one with the 4 hospitals in the county, a couple of the larger physicians groups, and a couple of specialists. In that group, we've done a lot of information sharing, best practices, just seeing what everybody's doing. But we've also got a smaller group that consists of our 3 larger hospitals with 3 representatives from each. And we meet about once a week. We do some planning, talking, and really try to figure out where we're headed and where we're going to find resources should different scenarios arise.
The hospitals, I think, are doing a great job here in our community. You're, of course, doing a wonderful job. I want to turn your attention maybe to our local communities, our local municipalities. I know they probably have some challenges in front of them. How are you working with our local municipalities, such as the City of Washington or South Franklin Township, where I live, Monongahela? How are you coordinating with them on their response?
Well, there are a couple of things that we do. We have a very, very good email list. We have all the municipal officials on that list, and everything that we get as far as press releases, information, we share with all the municipal officials. And that's been well received, and I think that's helped them. The other thing that we do is we work with all the responders, the fire departments, the police departments, the ambulance services. We share the appropriate information that we get with them, but we also distribute personal protective equipment to those folks as well. We've done that, I believe, 4 different times since this started. And we've provided them with N95s. We've given them face shields, gowns, Tyvek suits. Again, obviously the N95s, patient masks for EMS to put on their patients. So we've tried really hard to make sure the responders are protected as well as they can be protected.
And how are you finding our local municipalities? Pretty receptive to this?
Yes, they've been very receptive. They've been helpful. A lot of them have asked a lot of good questions. They've put things in place in their communities to try to protect their residents. So yes, they've been very receptive, very helpful.
Now, Jeff, before I ask you our next question, I want to remind our participants this morning that we will be engaging with Jeff and allowing you guys, of course, to ask some questions to him. So we'll start that in a few minutes, and I would encourage you to start sending your questions for Jeff Yates. Jeff, you've been with the county as public safety director for about 24 years.
Yes, sir.
How does this rank with other emergencies such as the Election Day flood of '85 or recent snowstorms, things of that nature?
This is by far the most challenging. I worked the flood of '85 actually before I was a county employee.
Actually, would you mind telling us how you started with that? I think that's an interesting story.
Yeah, well, actually, the people that I had worked for had talked with, at that time it was Bracken Burns was director of emergency services, and he needed some assistance, and my employer allowed me to come down and assist at that time director of emergency services Burns with dealing with the flood of '85. It was something that was kind of interesting. I enjoyed what I was doing, helping with a disaster. And about 6 weeks later, I left my former employer and started to work with the county. So I worked under Bracken for about 10 years until I became the director. I started off as director with the blizzard of '96, the flood of '96. Then we dealt with the tire fire up on Detroit Avenue in Washington, all within a span of about 4 months. We've also dealt with the H1N1, a couple of other floods, blizzards, 9/11. And so far, this has been the most challenging thing that we've had to deal with.
And challenging in terms of coordination, just the scope. So if you could expand on that for a little bit.
Yeah, a lot of it's the scope. this is the first time something has really hit every municipality in the county as far as everyone being called to action and needing to respond, needing to do different things. And this has also been the most challenging as far as supplies. Before, if we needed something, it might take a day, it might take 2 days, but we always got it. That's not the case here. There are things that we've needed for several weeks and haven't been able to get.
We have a couple of questions coming in. A few have to deal with the stay-at-home order. Of course, there's been a lot of talk about how long the stay-at-home order will go on. It seems that every other week it's extended another 30 days, things of that nature. We're not asking you to give us a set date, but could you perhaps maybe expand upon your thoughts on when we may hear there might be an extended stay-at-home order?
And that's a really difficult question. And I feel bad quoting the Secretary of Health, but on a repeated basis, she says the virus determines what our next actions are going to be. And that's true with the stay-at-home order. I think it's helped us out a lot. It looks like we're getting a flattening in the curve, which is a great thing. But that's something that we need to caution people. Just because it looks like we may be getting a flattening of the curve or a stabilization, that doesn't mean it's now clear for everybody to go outside and start to socialize again. We still need to stay vigilant, stay home, maintain social distancing, because we're not out of this yet. Even though we might be flat or on the downside, if we relax our guard, we get out too much and start mingling with people, those numbers will shoot right back up again.
Okay. We've got a few calls, or excuse me, a few questions concerning local food banks and coordinated efforts between that. As you know, our unemployment rate, unfortunately, is getting a little high, of course, now in Washington County with all the layoffs and people being furloughed. And so the demand on food banks is becoming a little more stressed. Is there any coordinated effort with your office or anyone in the community to work with the food banks?
Yeah, that's not something that we've handled. We've fielded some calls and directed people to the food bank. Done a little bit with human services, but again, any donations are obviously very helpful. So we've heard different things from different people about some hardships in the community, and helping the food bank. Donations to the food bank are obviously very much needed at this point.
I would also like to talk to you a little bit about other local efforts. For instance, the Monongahela Historical Society is leading an effort to provide PPE down from the Mon Valley Hospital. Leadership Washington County just announced an effort called Feed the Fight. I know your office doesn't coordinate all these things, but how could our member companies, how can those in the community that want to help, and we've seen a real strong outpouring from companies and from individuals that want to help, what would you recommend the best thing for them to do?
I think what helps the most is looking at companies that may have supplies or different things that can be useful for the community or for responders in general. It's kind of refreshing to look at some of the folks out there. For example, we've had dentist offices contribute N95s and different hand sanitizers and wipes, because obviously their office hours have been cut, their patient contacts have been cut, so they've made different contributions just to the effort in general. Pittsburgh Connect has donated a lot of clear face shields that have helped their responders. Pennsylvania distillers have turned around and gone from manufacturing alcohol to drink to producing hand sanitizer, different sprays, and different things like that. So, we've gotten a great deal of help from the community, with just all different facets of aid.
Well, as you know, with social distancing, people staying at home, there's been more activity, of course, on social media, people still trying to connect with each other, maintain relationships, both business and personal. However, how do you deal with someone that is perhaps on social media spreading falsehoods, creating panic about that, about the current situation? How would you recommend some of our participants handling that situation? Because we actually got several questions concerning that.
We've seen a lot of really bizarre things on Facebook. Um, and you know, we really don't engage people on Facebook. That's really a losing proposition for us. But what we've suggested people do is, you know, take a look at the official county webpage, take a look at the public safety webpage. Our county commissioners have a Facebook page, and those all have good, reliable information. Um, the other thing that I would suggest people do if they have questions, you know, they hear rumors. We've established an email account that deals with that, and that's public information at co.washington.pa.us. And people email us questions all the time. We take those questions, research them, and we get back with the people and tell them the truth and let them know what's really going on. And again, if somebody's interested, if they go to the county webpage, that's listed on there. There's a button that will take somebody straight to that public information at co.washington.pa.us, and they can ask us anything they want, and we will respond.
In terms of private companies in Washington County, have any reached out to you to offer assistance, offer help? And if they have, that's wonderful, and we appreciate that. And also, how can we become more engaged? How can our members become more engaged with your efforts?
Well, at this point, like I said, I think a lot of it really comes down to reinforcing that stay-at-home message, the social distancing, the wearing the masks. And if people have supplies that are useful, any sort of PPE, hand sanitizers that they can spare, that's something that we can always use and distribute to our first responders. Because again, we've done our best to equip the first responders, but they really are at a point where they have the minimal amount of protective clothing. You know, we would like to see the numbers of masks that we have go up, you know, gowns, Tyvek suits. In fact, we had, you know, somebody here in the city give us a really good price on Tyvek suits. And I was fortunate enough to get, you know, permission from the commissioners to buy several $1,000s worth of Tyvek coveralls. So we've supplemented some of the things we've gotten from the Strategic National Stockpile with some local purchases. And that's made a big difference because there really isn't a lot of protective clothing like that available. So we were very lucky that way, and you know, we're glad that that company stepped up and gave us such a good price.
And have you noticed a lot of coordination between companies and your office in terms of people reaching out?
Yes, we've had a lot of calls with people offering things, and that's been really good for us. But the one thing I would also suggest is, as much as people would like to help some of the locals, that we act as a central repository for donations. We're trying hard to make sure we get as equitable distribution of PPE as possible. You know, we've got some people that, you know, they're running hundreds of calls a month versus people that run 5 or 6 calls a month. So we're trying to make sure that those people that have the highest call volumes have the greatest amount of personal protective equipment, but we're still not ignoring the people that have just a few calls because they need to protect themselves as well. So if we can, you know, maintain that role as the central point of contact, the central point of distribution, we make sure that the equipment gets out there to the people who need it and nobody gets left out.
Okay, thank you. You know, I understand you don't have a medical background, Jeff, but there's been some questions here concerning antibody testing. If that comes about, how do you think that would be coordinated through Washington County? Would that be through county government or local health providers? How would you see that rolling out?
It would really be up to the hospitals. But again, you know, we've got a really good relationship with the hospitals, and our commissioners have a really good relationship with the hospitals. So I would see that as a combined effort. Well, obviously the hospitals will be doing the testing. You know, we would help a lot with the coordination and, you know, the public information to make sure people knew where to go and what to do.
Yeah, I've seen a lot of you know, remarks, quotes, things of that nature that would say that the opening in the economy would be tied to something like as broad scale antibody testing. Do you see that? Or in terms of opening the economy, do you see it more of a slow rollout in terms of moving forward, something that can happen? I highly suspect it won't happen overnight. hearing a lot about, slow rollouts, slow starts to the economy. How would you see that opening up? And please know we're not going to hold you to this.
Yeah, I really would anticipate it being a slow rollout, just like you'd indicated. As we've watched every phase of this pandemic, that's how everything has been. It's been a slow rollout. And I hate throwing this term out, but this is unprecedented territory. Nobody's ever done this before, so we're really learning as we go. The supply chain is ramping up in different ways that it's not done before. So yeah, everything that we do is going to have that slow rollout, and I wouldn't see this being any different.
Yeah, we've seen that also too, that there might be a lot of changes in how we do business in terms of how we go to restaurants, how we do things. Do you think that is a immediate reaction or something that you feel may be a long-term change in what we do?
So I would anticipate that being a long-term change, because there's a lot right now we don't know. There's talk about potential vaccines. We don't know if that will be the case, if that will even be developed. They talk about different potential cures. We don't know how that will play. If things stay the same, there's a good chance that we'll run through this particular wave of this pandemic, and there could be another one comes behind it. So there's a lot of unknowns. This may be it. It might be done. We might be dealing with this again this time next year. We just don't know.
So you find this, again, as you just correctly stated, there could be another COVID-20, coming up in the fall or something like that. So how would you say our county society should prepare? This might be a good way. What we're going through right now is to kind of give us some guidelines on how we prepare for this. Do you find that?
Yeah, I think, we've had a lot of individuals ask, and, the rule of thumb used to be people should always maintain about a 3-day supply of food and water. What we've been recommending people, if possible, try to have about 2 weeks of food on hand. It minimizes trips to the store, minimizes contacts, and think ahead about, potted meats, things that stay longer, anything that kind of keeps you out of the store and out of the mainframe. As different supplies come available, we don't recommend anybody hoard anything. But if you saw hand sanitizer and grabbed a couple of bottles, that would be a good thing to do. Obviously don't buy all 24 bottles sitting there on the shelf, but grab a couple for yourself and look towards the future and think that these are things that you might need. The same thing with masks. If masks start to become available, if you have a chance to buy a few, buy a few. Don't wipe the store out, but get enough for yourself and your family to last you for a couple of weeks. We're at a time when people really need to be prepared and think ahead and think about what they might need, in their house for, longer than 3 days, longer than a week, maybe as long as 2 weeks.
That's an interesting point, something I haven't thought of before, Jeff, in terms of keeping a 2-week supply of food, water, things of that nature at your house. Not so much for shortages, but just to limit your exposure in going out. Is that what you're saying?
Absolutely. There have been some runs on stores, particularly, if you look at the toilet paper disappearing, some of the fresh meats disappeared, and things like that have happened. And realistically, like I said, I don't see there's going to be a lot of shortages with basic staples, but just having the stuff on hand to keep people at home, makes a difference. I mean, for myself, it was an adjustment because I was used to stopping at the store just about every day on the way home from work and just grab something for dinner and away we go. But, obviously that doesn't happen anymore. We bought enough food that we don't have to go to the store every day or every week. And that's what most people should do. If they can do that, have a good stockpile. Again, not because they think there's a shortage, but just to keep them out of the stores and make it easier to stay home.
We've been getting a couple of questions concerning what can we do? What can we do individually to help you or our community right now? And what we can do as a business community. Would you mind expounding on both of those?
As individuals, again, I think that's probably the easiest. And that's really just, again, obeying the stay-at-home order, maintaining the social distancing. If you have masks, wear masks. people that have the ability to sew and can make masks. If they can do that and share them with the hospital, share them with the police, the fire departments, EMS, those kind of things those are very helpful. You know, people that talk about the truth makes a big difference. You referred to social media earlier. That's been one of the biggest problems that we've had to deal with throughout this whole pandemic, are the crazy rumors that people spread. So as much as people can stay informed, spread the truth, ask questions, and find the truth out, and not run with rumors makes a big difference. From a business perspective, we ask that the business owners support their employees and spread the word with them. That's it's important that they understand the truth, they respect the situation without being paranoid, and that's a message that we try to get out. As far as helping the emergency response community, obviously any protective clothing that can come out and that we can distribute to people helps. The hand sanitizers help. Any kind of disinfectants help. Those are things that we really need right now. Again, it's looking out for one another, with again maintaining that social distance are all key elements in making this situation better.
And one quick question for you: how are you trying to relax, Jeff? I know you've been probably really busy the past several months. How are you relaxing? What are you doing to take it easy for a little bit?
I'm not really sure what relaxing means anymore. It's been kind of busy. I did get to sit out on my deck for a few hours on Easter and just kind of enjoy the sunshine and listen to some good music, and that kind of helped. That doesn't happen nearly frequently enough, but that does help.
Well, I'm very positive we're going to get back to that hopefully very soon. But Jeff, would you mind repeating the address for your website where people can go and get some information?
Yes, I would suggest that, like I said, if there are any kind of rumors that people want to have dispelled or they need information, the email address is publicinformation, all one word, at co.washington.pa.us. The county website is www.washington.pa. I'm sorry, I screwed that one up. And we go back and just say, if you Google Washington County, you'll come up with the website. But go there, and there's a lot of information dedicated to COVID-19, and our public information email address is listed on there as well. And people can also look on our Facebook page. The county commissioners have a Facebook page with a lot of great information on it as well.
Well, Jeff Yates, Director of Public Safety for Washington County, we certainly appreciate your time today. Thank you very much for being with us, and also thank you for the great work that you and your team are doing at the county to keep us safe. We really appreciate it, and thank you for being with us.
Thank you, Jeff. It was a pleasure.
And also, too, thanks to our sponsors, ATI Flat Roll Products, California University, Pennsylvania, David Davis Communications, Steptoe & Johnson, and Triple. We appreciate your continued support of the Chamber. We appreciate you being with us this morning as well. Our next morning briefing will be next Thursday, April 23rd, where we will welcome Brandon Mendoza. He's the Executive Director of NAIOP Pittsburgh. And Brandon will be talking about the real estate market, COVID-19's impact on our economy as a whole, of course, what we can see moving forward in commercial and industrial development. So we hope you'll join us next Thursday, April 23rd at 8 o'clock for our next morning briefing. On behalf of the Washington County Chamber of Commerce, we appreciate you being with us, and stay safe.